Testosterone treatment has become quite the raging fad, claiming to regain your fountain of youth to curing everything under the sun, from low libido to fatigue and even depression. How true are these claims? And what are the benefits and risks of taking testosterone? Let's talk about this hormone hoopla coming up. If it's your first time here, I'm Dr. Majd. Consider subscribing to this channel for up-to-date medical topics, news, and headlines. The American College of Physicians, or ACP, expert group just released on January 6, 2020, a new guideline for doctors to follow when it comes to recommending testosterone treatment for adult men with age-related low testosterone levels after reviewing the current literature and research and considering the effectiveness, the safety, and all the risks. They evaluated 58 already performed studies, 38 of them being very good, solid studies that lasted at least 6 months in duration, in order to assess the patients based on various factors such as sexual functioning, physical functioning, quality of life, energy, depression, concentration and thinking, major adverse cardiovascular events, and other adverse events as well. After this comprehensive evaluation, here's what they concluded. Testosterone may only be helpful in older men who experience sexual dysfunction and have low T, which is the term coined for testosterone. But even so, that it should still be reassessed at least once a year to determine if benefits still outweigh the risks through time. They concluded that, interestingly, that it does very little to improve other vague and more complex symptoms that testosterone has claimed fame to, such as depression, fatigue, and the concentration, etc. A gradual decline in testosterone levels with age is absolutely a normal and expected process for men. It begins in the mid-30s, yes, and it decreases about 1.6% per year thereafter. And according to the study, 20% of men over age 60 have low T, 30% over 70, and 50% on those over age 80. So how would you know if you have low T? Well, interestingly, the experts don't agree on what the normal blood testosterone levels even are. So if we can't even define what normal is, how can we accurately define what low is and what our target level should be when we initiate treatment? If you do get tested, however, note that most accurate measurements are morning fasting ones, and if low, then they should be repeated once or twice more to confirm consistency, because hormone levels can fluctuate in men too. Yes, they can. So why do doctors have such reservations about prescribing testosterone in the first place? I mean, what's the harm? Well, besides a possible increased risk of heart attack or stroke risk, the number one killer of men and women in the United States, the list also includes elevated hematocrit levels, which can increase the risk of blood clots, prostate enlargement, and exacerbation or worsening of prostate cancer, which by age 80% of men will statistically have, agitation and irritability, infertility, and decreased sperm production. If you're trying to conceive, do not take testosterone. Decrease in testicular size, worsening sleep apnea, and acne. I have a few older male patients on testosterone. There's still a lot that we may not know. I'm simply just reviewing the studies that what they've shown up to this point. If it's helping, then it's helping. As long as you're not taking unnecessary risks by taking it and then the pros outweigh the cons for you, then yes, it may be worth taking. The ACP also recommends the injectable form of testosterone over the other formulations like the patch or gel. Even though they're more convenient, there's a huge cost difference. So according to the Medicare database, the injections cost about $156 a year compared to $2,100 for the other formulations. Yes, by the way, ever wonder who coined the term low T? The pharmas, that's who, because they're now legally able to advertise on TV. They have direct access to your brain to present very biased information designed to, I want to say, brainwash, but that might be a little harsh, influence you by depicting healthy, aging, physically thriving males in their ads, smiling and laughing with the ladies, running a marathon with their cute little Labrador galloping by their side, and adding a dash of inspirational music in the background, and they've hooked you in. I mean, who doesn't want to be 60 years old and still looking like Arnold? Okay, yeah, that was not a good example. I wouldn't want to look like Arnold. I don't know about you. Let's go with Brad Pitt. Ooh, yes. Speaking of testosterone. Well, now you know how doctors feel about those bogus commercials. I don't know, that's my opinion. Just note that if there is an ad on TV or in a magazine for a drug, you better bet that that drug is outrageously priced and not generic. Testosterone treatment more than tripled their sales from 2001 to 2013, from 70 million to 2.8 billion. Yes, billion. It wasn't until a rather ominous study published in 2013 suggesting that there's an increased risk of heart attack and stroke in men who take testosterone when the FDA required this warning to be added to the product labels that some patients started to rethink their interest in taking testosterone. Anyways, I digress. Bottom line, hormones are simply like one component that can affect things that like our mental health, concentration, weight gain, fatigue. I mean, these are all multifactorial medical issues, meaning that there's more than one factor affecting them. Like changes in life circumstances, like retirement, let's say, change in relationships, empty nest syndrome, stress, anxiety, financial burdens, etc. Why do we always have to throw medications at everything? Sometimes just allow your body to do what it's supposed to do, and we don't have to always fix every little symptom, and it's not always possible anyway, as in the case with some of these men who yearn for their mojo and that fountain of youth. As a woman, I yearn for that too, believe me. But I'm just waiting for the day that I can be cloned or frozen in carbonite or something like that. If you found the information valuable, which is always my goal, subscribe, ring the bell, like, and consider sharing this with someone else who may find this video useful. Well, thanks for tuning in. Stay healthy, and I'll catch you next time.